So does FLT3 MRD after cycle 2 inform transplant decision in CR1 currently? So, I mean, I think that's a really, really big point. And I can tell you, we have patients coming in for that discussion. We do have access to the high sensitivity assays, and it's hard because nobody really feels like going through a transplant if they don't have to. But at the same time, I would argue that currently, monitoring carefully doesn't cure you of disease. It monitors. And I think what we don't know is whether or not those patients can, if you have a very healthy 40-year-old with a good donor, are you going to rely on the MRD data not to transplant that patient? I can say that personally, it is influencing transplant decisions, especially if there are reasons where I'm unhappy to do a transplant, either biological ones, medical ones, clinical ones, social ones. If I would love not to be doing a transplant on a patient and I have someone who is completely negative, I am considering that strongly. But if I have a very, very strong, excellent patient with a strong, excellent transplant, I am nervous about changing practice just yet.
But I think one thing that you mentioned in your presentation that's important to emphasize is the quality of the MRD testing, because optimal MRD results with a suboptimal test is not equal to confidence. So if I don't have that access to that MRD level of measuring, I'll say I'm going to transplant my patient.